Bourning is an Aboriginal English word that describes coming into being in a spiritual and physical context and demonstrates a richness of culture that is not seen when using the equivalent Western word birthing. I want to acknowledge the Wiradjuri people, who are the traditional custodians of the land on which I live and where I am today as I record this presentation. I pay my respects to all elders past, present and emerging, acknowledge the richness of their culture and that sovereignty was never ceded. Hereafter, I will respectfully be using the term Aboriginal to refer to Aboriginal and Torres Strait Islander people. Please note that this presentation may contain images of deceased persons. Let me start by introducing our artist Melanie Harver, whose Aboriginal name is Winden, meaning green pigeon, and her artwork titled Birthing in the Rainforest. Melanie has an Austrian father and a mother who is a proud Marmu Aboriginal woman. She is from the Dougal Barra and Warri Barra people on the Johnston River in far north Queensland. Her deep cultural connection to these lands of wet tropics can clearly be seen in this artwork. In Birthing to the Rainforest, we see an Aboriginal elder, most likely known as grandmother, gently touching the pregnant woman as they stand beside a large birthing tree. The image is vibrant, spiritual, and portrays the feeling of history, tradition, safety, and well-being. Sadly, it is a stark contrast to the reality of birthing today for many Aboriginal women, who are much more likely to birth in a medicalised setting, surrounded by non-Aboriginal caregivers with little, if any, cultural safety. As a mother of 3 children myself, an aspiring midwife, and now a passionate student of traditional Aboriginal practices, I was immediately drawn to this artwork and its important reminder of the rich cultural birthing practices of Aboriginal women over many thousands of years. If we look at the history of birthing, we see that before colonisation, Aboriginal birthing was based on thousands of years of shared cultural wisdom and skills that were passed from woman to woman for many generations. Grandmothers and aunties were responsible for birthing practices specific to their language group or nation and played an important role in midwifery. While grandmothers applied bush medicine to help with the labour and feel and guide the baby out, other women from the extended family would sing the baby out. Birth was and still is seen as important secret women's business. Depending on language group and geographical location, rituals and traditions included using sacred birthing trees, burying the placenta, and smoking ceremonies to welcome the baby and establish lifelong health and connection to the land. Some cultural groups gave totems to the children to reflect their family lineage and to connect them with the creation time and the spiritual world. Today, birthing for Aboriginal women looks very different and is influenced by a broad range of social determinants of health, not least the lasting and devastating impacts of colonisation that continue to cause pain and disadvantage. Other influencing factors include remoteness, access to cultural safety, and chronic disease. Sadly, the evidence demonstrates that the well-established disparities in Aboriginal health outcomes are also reflected across pregnancy and birth. We know that one of the greatest threats to the well-being of children is being born preterm or at a low birth weight, and this is deeply concerning when we compare the statistics and outcomes for Aboriginal versus non-Aboriginal mothers and babies. These issues in turn impact health in adulthood and are associated with diabetes, cardiovascular and renal disease. Aboriginal women describe a range of issues that impact their pregnancy care and birth choices, with one of the most prominent underlying issues being the intergenerational trauma from the stolen generation and the ongoing high rates of forced child removal still experienced today. They may feel traumatised and abused by the medical system when touched without being asked, or by having their family forbidden to be with them during birth. They are unlikely to have an Aboriginal midwife or care provider who understands what is important to them and how their family works. Racial assumptions and unconscious bias can also leave them feeling undermined and small. And in some remote areas, women must be flown to a nearby city at 36 weeks pregnant to wait for labour and give birth in a hospital all alone and away from her ancestral land. Many women just aren't able to access appropriate maternity care programs. Designed to change the trajectory of poor pregnancy and birth outcomes, Birthing on Country recognises most women are unable to birth on homelands in a traditional sense, and so brings country with them into the modern healthcare setting. The statistics show that women are most likely to birth in a hospital rather than physically on country, so they will need to bring country with them to be able to experience a spiritual birth connected to their land. There isn't yet sufficient evidence to secure broad sector reform and funding of birthing on country programs, but the evidence is building. We can see that it does make a difference, with one study showing a significant outcome of halving preterm births in just 5 years. This is something that urgently calls for more research and application. As emerging healthcare professionals, we need to remember that these poor health outcomes for Aboriginal mothers and babies did not just happen. They are the result of decades of terrible history following colonisation, a history of shocking violence, oppression and unspeakable acts. It is up to us to learn the truth of this history and to play an active part in health systems reform and the advancement of reconciliation. Thank you for listening.